the President of Consortium of Accredited Healthcare Organizations, CAHO, Dr. Rajiv Singh, Director General of Indian Chamber of Commerce, my good friend Mr. Devapam Raha, Executive Director of KPMG Advisory Services, and the entire team of ICC. A very warm welcome to all the participants and all the attendees. This has been a very new experience for us, which we will delve upon very shortly. At the outset, let me welcome you to a window between the second and the third wave. We, as a healthcare fraternity, have, in my opinion, done a pretty good job in handling the second wave. In various parts, we had different types of peaking challenges, whereas in some parts we were facing the challenges of shortages of material. In some other parts, we were facing challenges regarding manpower and other things. However, I think that the private healthcare sector has done a phenomenal job serving the people of the country, fulfilling our true responsibilities. We have taken pride in overworking our assets and our human capital and provided the best possible services that could have been expected from any sector of the country. And on that note, it makes me a proud citizen of the country to represent this sector and to humbly accept the good work done by all. So my heartiest congratulations to all of you. Now we stand at a position where the next wave speculatively will hit us very shortly in a few weeks' time. We have learned from the first and the second waves, and the third wave is holding new challenges, which I'm sure with our endeavor, we will be able to overcome just like we did the first and the second one. During my exposure to your activities of how you have handled and tackled this pandemic at your various levels, whether it was a 50-bedded hospital or a 500-bedded hospital, the kind of work which you have presented in your submissions and in the presentation that you have supplied us with, it is just filled with awe. And I wish that we can take the time to draw lots of lessons to share with the industry sector of the good practices across the geography of India and across the scale of hospitals. It really is remarkable, the kind of work that has been put in. However, this is a very joyous occasion. This is the first time where an institute like ICC is conducting an awards for the sector, which is very deserving for our healthcare sector. And we are addressing entries from north to south and east to west. We have had multiple types of participants, from small operators to very large hospitals, the smallest being a 20+ bedded hospital and the largest being a 1200 bedded hospital. And through the various scrutiny and the excellent work compiled by KPMG, the brainstorming done by the jury team, I hope the results that we have come out with are not just and fair, but also acceptable to all and sundry. This is a fantastic initiative of awarding to the deserving and to recognize the activities which has gone into building the sector what it is today. As we are all aware, healthcare does support more than 60% of the private healthcare supports about 60% of the healthcare services. Private means private, anything which is non-government, trust operated, or any other institution operated. So together, collectively, I look forward to a fantastic evening today because we have a lots of innovative awards also. And a lot of companies which have come to the fore because of this process, which otherwise we would not have known. So without further ado, I would like to hand over the event for the proceedings of the day. And thank you very much for giving me the opportunity to handle and to represent this sector. Thank you so much.
Suparna, you are on mute.
Thank you, sir. Now I would request Dr. Vijay Agarwal, President CAHO, to please address on are we doing enough for patient safety? Over to you, Dr. Vijay Agarwal.
Uh, Thank you. I am very thankful to the Indian Chamber of Commerce for giving me this opportunity to share this platform with you all. Just one second. So let me share my screen. Yeah. So I bring you my greetings from the Consortium of Accredited Healthcare Organizations, what we call as CAHO. And this organization is mainly and only focused on promoting patient safety and accreditation in the country. So the question that we are trying to answer today is, are we doing enough for patient safety? And the important question is that patient safety has been high on the national agenda in the healthcare for more than a decade now, and on the international agenda for many decades. Considerable efforts have been made to improve safety, and it's natural to ask the impact of these efforts that have been made, that are they well directed? Are patients any safer? So what is the difficulty in answering is that some aspects of safety are difficult to measure for technical reasons. Because what is preventable and what is not sometimes becomes a little complex. Main problem is that measurement and evaluation have not been high on the agenda of the healthcare organizations. The absence of solid measurement of safety and indeed quality is a worldwide problem. Measuring safety in healthcare is much more difficult than measuring safety in other domains where mistakes and injuries are fewer, less varied, and can be more clearly defined. So if you see the global perspective of the medical errors, you find, if you look at the annual deaths from medical errors from various countries, right from Australia, US, Germany, United Kingdom, Canada, and of course then India, you find that there are staggering number of the deaths which are occurring because of the preventable medical errors. And in 2018, as per the WHO estimate, we had 52 lakhs people dying of preventable medical errors. We can say that the start of the patient safety movement in the recent time can definitely be linked to this landmark report from the Institute of Medicine in 1999, which was "To Err is Human," which reported that up to 98,000 Americans were dying in USA because of preventable medical errors and were costing like $50 billion in total costs. 7% of patients suffer from a medication error. Every patient admitted to the ICU suffers an adverse event. 1 in 3 people say that they or a family member has experienced medical error at some time in their lives. And most of these are preventable. But even 2 decades later, after the IOM report, which was in 1999, the steps taken to make healthcare have been highly reliable. Let's see what steps have been taken to make the patient care safer. So it has been a multi-pronged approach. So first of all, the leadership had been sensitized to this problem. Accreditation and statutory compliances became a very central to the healthcare. Guidelines and protocols started appearing. Technology started to play a role. Curriculum is being impacted, and patient experience is being taken into consideration. And we can look at each one of them one by one. So this all together is what forms culture of safety. Unfortunately, for example, some of the hospitals and some people outside it feel that accreditation alone can lead to culture of safety. That's not true. It is actually a combination of all these things combined, which will eventually form culture of safety. Accreditation should be taken as the beginning of the quality journey rather than the end of the quality journey. So leadership became, I think, the most important and still remains the most important, because without the leadership being sensitized to this issue of patient safety, everything else will be just I think, a lip talk. So leadership has to ensure that there is a non-punitive approach to learning from mistakes. There is a commitment, involvement, and resource allocation for quality, faster resolution of issues, improved environment of care, created transparency and openness. That's what is expected out of leadership. Accreditation and statutory compliances improved the public trust, ensured a safe environment that reduces risk, offered quantifiable benchmarks, improved outcomes and patient experience, enhanced efficiency, reduced costs through standardized care. Guidelines and protocols, which were also actually somewhere it will also be a part of the accreditation, but they are very important. And even in the non-accredited hospitals, people have started to follow some guidelines and protocols, which result into, again, established clear process, standardized care, elimination of the variation, established predictive outcomes, peer pressure, improved performance, benchmarking, and focused on special population for better care. Guidelines and protocols, the interventions can be that do institute analysis, instituting failure mode effect analysis, and identify list of never events. And therefore, the benefits will be you help rectify the processes rather than blaming individuals. This is a very important part, that whenever there is a mistake that happens in a healthcare institution, and it is not possible to build an institution where there will be no mistakes. But we must learn from the mistakes and we must rectify the process. It is the process failure majority of the times. So it helped focus on system failure, mitigated risks prior to initiating the new process, helped organization to focus and prevent occurrence of those events. Technology has played a great role in improving patient safety, again, because technology will help you when the processes become very clear, standardized care, again, elimination of variation, establishing predictive outcomes, peer pressure, improved performance, benchmarking, and focused on special population of better care. So technology is only enhancing actually the implementation of the processes and guidelines which were mentioned earlier. And then if we look at the curriculum, the medical curriculum so far had no kind of, I would say, content which was related to patient safety. So introduction of patient safety, communication, and teamwork as curriculum topics in medical and nursing schools will and has resulted in improved collaboration, enhanced communication, and other soft skills of care providers, established patient safety as everyone's responsibility and not just the physician or the quality manager. So patient experience is, again, this was never kind of taken into consideration. So now the intervention which is required is that we have to be instituting a patient-centered care and instituting a patient advocacy groups. And this will result into improved patient outcomes, improved patient satisfaction, improved patient compliance to care delivery, and empowered patient will help in voicing their concerns. And this is going to be the game changer if really we want to improve patient safety in the organizations. Now, all these things had been instituted. The issue is this, number one, if we look at what has been achieved in our own country, but before that, let us see that what has been the impact. For example, in one of the example which we are getting is from the UK's National Health Service. So NHS data was used to assess the change in several core areas that reflect the safety of healthcare and focus on measure of outcome in the sense of definable events that happen to patients like infections, morbidity, mortality, and on key measures of process such as drug errors, for example. So hospital standardized mortality ratios show that in hospital mortality has fallen significantly over the past 11 years. The ratio is adjusted for several factors, including age, sex, diagnosis, whether the admission is planned or unplanned, socioeconomic deprivation, comorbidity, and season. So one does see that over the past few years, at least in these developed countries, they have been able to show a significant reduction in mortality. Shorter admissions and changing discharge policies may have some bearing on the reduction in the hospital mortality. But even then, after adjusting everything, we see that there has been a reduction. The overall picture, although difficult to interpret, suggests that the care is at least as safe and may be improving. The Society of Cardiothoracic Surgeons has collected data for over 20 years, and there is evidence of improved outcomes in cardiac surgery, with a reduction in mortality in the north of England from 2.4 in 1997-98 to 1.8% in 2004 and 5. Scottish audit of surgical mortality has separated unavoidable deaths from those in which adverse events contributed to the death, providing an indirect measure of safety. So the issue is this, that unfortunately, this kind of a data which has assessed the impact of various measures that have been taken in the country or in any geography over a period of years, there is very, very little data that comes out. So there is a great need to do that assessment. There is a great need to anyway, once again, look at those things, and we find that if I look at the length and breadth of our country, a lot of it is still very lacking. Now let's look at the top 10 risks have been described by ECRI, which is the Emergency Care Research Institute. Is one of the very reputed institutes which gives a analysis from the healthcare, and they find that what are the top 10 risks in, let's say this was in 2020. So for example, missed and delayed diagnosis is a great risk for patient safety. Maternal health across continuum still remains a huge risk, and this, friends, is applicable to all over the world. Mainly this data is from United States. So early recognition of behavioral health needs is the third part of the top 10 risks. Responding to device problems and learning from them. The device cleaning, disinfection, and sterilization is another one. Sixth one, they say, is standardizing safety. Seventh, patient matching in the hospital electronic record. Then eighth is the antimicrobial stewardship. Ninth is the overrides of automated dispensing cabinets. And 10th is the fragmentation across care settings. If we look at each of these, I think it will ring a bell even to us. And I think we may, of course, think of probably many more. The top 10 risks in our country may be slightly different, but I think all the 10 which have been mentioned by ECRI are very, very pertinent. So conclusion from international studies is that although there has been a lot of learnings on the epidemiology of safety and several effective interventions have been developed and implemented to reduce patient harm, their implementation and practice has been inconsistent. Even never events such as wrong patient, wrong site surgery still continue to occur in hospitals. The transformation of healthcare for the future is depending on the big data, predictive analysis, and artificial intelligence. The principal approach is to establish local and national reporting systems. These systems invite voluntary reporting of unspecified safety incidents with the aim of learning lessons and feedback the findings into the system. Now, this is such a big problem because any problem occurring in any hospital is normally swept under the carpet because of the fear of the consequences which the hospital or the particular doctor or the nurse has to face. So unless we will create a non-punitive culture and we will start reporting these incidents and we start learning from them, there is going to be a great problem. However, these reporting systems do not effectively detect adverse events. In the most recent comparison, reporting systems detected, they said, only about 6% of the adverse events found by the systematic review of records. So picture globally, before this pandemic began, it was estimated that globally more than 13,150 people were dying every day in hospitals in ways that could have been prevented. And if we had made the safety of our health system for both caregivers and patients our number one priority, many lives would have been saved. There is no single villain to blame. It is the system that have been set up ineffectively and the lack of transparency in delivering care. When we don't talk about medical errors openly and honestly, the same mistakes happen again and again. Silence impedes learning and perpetuates the preventable harm, too often resulting in unnecessary harm and death. Concluding, in India, are we doing enough in India? Of course, a big no, because we see that less than 5% hospitals have been accredited in the last 15 years or so. Focus is more on getting accreditation than implementing quality. Reimbursement government schemes results into the hospitals cutting corners. So the government is becoming, in fact, a partner to not promote patient safety. Can errors be discussed openly? The punitive culture and the media trial are the big deterrents. Poor infrastructure, hopefully the pandemic should change some of that. Changes in curriculum, we are still waiting for it to be more effective and happening it across the country. Move from the individual to team excellence is a great need to do in our country, and focus on never events. I mean, let's not think that you can imagine that in a country like United States, they have had an accreditation system working for the last 70 years. And in 1999, as we said, that there was a report that 98,000 Americans were dying out of the medical errors. I think the latest figure will be about 3 times, 4 times of that numbers. And even now, the medical errors remain the third leading cause of death in United States. So let's not think that merely accreditation can solve the problem. We must emphasize on at least focusing on that certain events, certain never events should not happen ever. So thank you very much. And I am really very, very thankful to the Indian Chamber of Commerce for giving me this opportunity to share at least these thoughts, which are very close to my heart and to the heart of my organization, CAHO, which is working day and night to promote patient safety and quality in the country. Thank you very much.
Thank you, Dr. Agarwal. Thanks for your detailed presentation. So now I would request Mr. Prashant Sharma, the jury chair, to please address us as we are moving towards the ICC Healthcare Excellence Award. So over to you, Mr. Prashant Sharma.
Thank you, Dr. Agarwal. That was indeed insightful. And normally these figures do not reach us. We do not come to know about these kind of inside numbers. I'm sure at some level all of us do know. But the very culture of not punishing the whistleblower and sort of, fixing the problem rather than punishing the messenger is what is one of the few steps needed in this direction. So Yes, I think I'm totally with you. I have witnessed multiple hospitals having near miss registers where they note down any issue which happens and then it's discussed in the quality meetings subsequently. So much to learn and so much to do. However, let us come forward and look at what we have in store for today. So let me first confess that chairing this jury was more difficult than I had possibly imagined. Normally, making choices for people handling healthcare is not a very difficult one because you do it practically every hour. But in this situation, it really was a bit of a tussle. It's because you're not choosing between a white shirt and a blue shirt, it's because you're choosing between 7 white shirts with varying quality. We had, for the same segments, hospitals of various sizes, of various ages, in different specialities. But it was very difficult to choose from that lot that whom to give and whom not to give, and whom should be considered, whom should be not considered. The jury had a difficult time, and I thank them for their extreme hard work, for their inputs, for their long hours. But more than anything, I thank them for not beating me up when I was pressing my way down, and as an industry person, advocating some practices over the other. We had multiple applicants from across the country. Being the first such award ceremony, the kind of response that we got was quite phenomenal. The numbers were overwhelming. Thankfully, we had KPMG, who my friend Devopam will sort of take you through the methodology of how it went about. But that made the job of the jury quite simpler comparatively. However, going through all the presentations, the slides, the innovations, the quality frameworks which you have built up, whether it is NPS or clinical outcome or recovery rate and how you are measuring your performances, etc., gave us a lot of insights which I believe can make a learning book by itself. And because it was applications from every part, whether it is Western India, Southern India, Northern and Eastern, etc., so it gave a sort of a platform for us to compare what was happening between different sectors, different geographies as well. Surprisingly, we saw excellence practically from every geography. We saw smaller organizations doing phenomenal work. The larger ones, which are more mature, have been here for decades, operating more than 1,000 beds. The kind of gigantic efforts that have been made to run such mammoth organizations is nothing short of a chapter to learn. I wish that we can form a sort of a best practices out of what we have witnessed and share amongst everybody, whether it can be emulated or at least get inspired from. Like I said, it was a very difficult task for me to chair the jury, but a very rewarding one as well. I came to know a lot of your organizations in depth and came to appreciate a lot many things which otherwise were oblivious to the eyes of a normal healthcare administrator. So I would like to thank each one of you for your enthusiastic participation. I would like to appreciate all the efforts which every applicant has made to bring forth all the inputs that were needed to be showcased. It has been a phenomenal experience, and I'm really happy to be part and parcel of this. Thank you very much, and all the best for all the participants for the coming next half hour. Thank you.
Thank you, sir. So now I would like to request Mr. Devopam Raha, Executive Director, KPMG, kindly address on award methodology. Over to you, Mr. Raha.
Yeah. Thank you, Prashant. I know that you have been very integral in the entire jury process and making it as fair as possible and following the methodology that we set forth. And I know we did not make your life easy. It is choosing between those 7 white shirts. But anyway, I think it was a very good job done. So good evening, ladies and gentlemen. Healthcare Excellence Award 2021 organized by Indian Chamber of Commerce, was conceptualized with a goal of recognizing, analyzing, and encouraging the effort of hospitals, insurance service providers, and medical equipment companies across India. The process we applied was an independent jury of experts was appointed to review the entry and assign scores on a scale of 1 to 20, 20 being the best. Basis the consolidated score of the jury, KPMG independently tabulated the scores to arrive at 40 winners in these categories. The entries with the highest scores per category have been considered winners. In each category, the entries with the top 3 highest scores were considered in succession winner 1, first runners-up, and second runners-up across regions. Overall, we received 68 entries across categories and regions, where 55 nominees were shortlisted based on predefined eligibility requirements, with the jury making the final decision in the event of any exceptions. Out of the 55 entries, as mentioned, 40 final winners across all categories have been selected for the Healthcare Excellence Award 2021. Today, the winners of the Healthcare Excellence Award 2021 will be announced for number 1, Hospital of the Year with less than and more than 300 beds, Best Hospital in Healthcare Delivery with less than 300 beds and more than 300 beds, Best Hospital in Quality Control with less than and more than 300 beds, Best CEO of the Year for hospitals with less than and more than 300 beds, Medical Equipment Company of the Year in R&D, Best Health Insurance Service Provider. Congratulations to all those who win. And as I said, that, whoever participated are winners. Hope you all have a pleasant evening. Over to you, Madhuparna.
Thank you, Mr. Raha. Now I would like to request our presenters to start the award presentation. Heartiest congratulations to all the winners. So now I would request our Director General, Dr. Rajiv Singh, to kindly do the summing up and formal vote of thanks. Over to you, sir.
Thank you. I must say that it is not important who wins and who gets the runner-up. I think it's important to be a part of something like this because for ICC, this is the first such award. And I don't think there would have been any better time than this year when entire nation is grateful to the doctors, to the hospitals, and the entire medical community for the great service they are doing to the nation, to the people. So I would like to begin by conveying my hearty wishes to all the winners, runner-ups, and the participants for sharing and showcasing their great work. I think awards are extremely important because they celebrate the good work, they showcase the great work, and they also, in the process, encourage building a culture of excellence and creating the excellence. So to that extent, I think everybody who has been a part of it really needs appreciation from all of us. You have just seen all the names of all the hospitals. All are very, very reputed. Most of them are very renowned and big names. There are also smaller hospitals who have done exceedingly well, who have created a brand for themselves, and they have really done extremely well. And ICC is happy to recognize all of you. I would also like to thank KPMG for being a part of it. Mr. Raha just took us through the entire process. And I think more difficult you make for us, I think it becomes credible, it becomes valuable, and it brings in transparency in the entire process. So we are thankful to you and your entire team for being with us and supporting an initiative like this. I am confident that the process which has been followed and the methodology which has been like guided by you will take this award longer and far ahead. And I'm sure maybe because this year, because of COVID, it's happening virtually, but I'm sure next year we'll be able to meet physically and we'll be able to host it at a place where all the participants, winners who are there, they will be all able to join and meet us, and we'll be able to personally greet all of you. Let me also thank our health committee chairman for his passionate and very, very, I would say, deep engagement with this entire process. I think one after another, we just saw a very large healthcare summit where we had some of the best experts. And then we had a digital healthcare expo, where again we had some of the countries, experts, and equipment companies and buyers, sellers. And now we have this. So I think within last 2 weeks, we have seen some of the best events which probably ICC has ever hosted in the healthcare space. So Mr. Sharma, thanks to you. And I would also like to thank the entire healthcare committee, all the partners here. Once again, a special thanks to entire KPMG team. And I would like to end by once again expressing our hearty wishes and congratulations to all the participants, winners, and everybody. Thank you so much.
Thank you, everybody, all the dignitaries for joining us, and congratulations to everybody from ICC. Thank you. Namaskar.
Thank you. So with this, we close.